Hi everybody, my name's Annette. I'm one of the bone marrow transplant coordinators at the Royal Brisbane and Women's Hospital, and I've been asked by the Leukaemia Foundation to talk to you today about donor searches. So here at the Royal Brisbane, we do both allogeneic and autologous bone marrow transplants. Allogeneic meaning the stem cells are coming from a donor, and that donor may be a family member, but it may be an unrelated donor also, and that's the group that we'll focus on today. So where does the donor come from? How can you become a donor? All those sorts of questions I hope to answer for you as we travel along. So we primarily do bone marrow transplants for patients with blood cancers, so leukemias, lymphomas, MDS, myelofibrosis, conditions that are affecting the bone marrow. The bone marrow is not working correctly. So these patients need a new stem cells to replenish their bone marrow after they have chemo plus minus radiation. So those stem cells, as I mentioned, either come from a family member or an unrelated donor. So when the patient is first diagnosed, our doctors will often visit us in our bone marrow transplant coordinator office and ask us to start a donor search for their patient. Now that donor search initiates with us visiting the patient and having a chat with them about do they have any siblings? How old are their siblings? Are their siblings in good health? And do they have a good relationship with their sibling? So we'll explore all of those options. And then at the Royal Brisbane, each different hospital does it in a different manner. But for ourselves, we ask the patient chat to their sibling and make sure that, you know, the relationship's good, but also that the sibling is willing to have that conversation and initiate that process of checking to see if they're a match. Patients with siblings that are, our cutoff in age is for siblings is 70 years of age. And also we don't do tissue typing blood tests. That's the test that we do. We don't do tissue typing on patients that are over 70 or that they've had a cancer in the last 5 years. So those two groups of patients we don't test, but other groups of siblings that are in good health and are willing to be tested and there's a good relationship, we'll organise that with them. Now, the actual testing process, if we're organising it for family members, it is a blood test. And that blood test can be local to them wherever they are in Australia or overseas. And we will help with organising that. And that will be sending them either electronically or in the post a request form for them to go to their local blood test collection centre and have these tests done. So the blood test is a tissue typing blood test. So that is for the siblings only. Now, we often get questions from patients or their family members, oh, I've got a cousin or I've got friends that want to be tested. Can you test them as well? We don't routinely do that here, just because there's a few resourcing issues around doing extended family members, but I'll talk in a minute how those people can help out, and that's by getting a test with the Australian Bone Marrow. So we will get the results of the siblings that will come through, and we will do the patient's doctor will do an assessment and see if there is a match with their siblings. And if there is a match with the siblings, we won't go any further with any further searches at that stage because they've got a fully matched sibling. And if they require a transplant in the future, then we will talk to the sibling as that moves forward. But we do make sure that the sibling is where they are a match, and also what is required of them if in the future that they are going to be the donor for the patient. If they are matched and they do need to be, and the patient does require a bone marrow transplant, we will ask them to come to Brisbane for the donation process. They do need to go through a medical assessment prior to the donation, and we've got a donor coordinator who assists with organising all of those logistical details like travel arrangements, etc. Now, Internationally, we do ask, and interstate, we do ask those siblings come to Brisbane, so that requires a little bit of coordination and logistical coordination as well. So we will assist as much as possible in those processes. But that initial tissue typing test to see if they are a match, that can happen locally close to home, wherever they are in the world, and we will assist with organising all of that. The medical assessment that needs to happen before the donation, that does need to happen here at the Royal Brisbane and Women's Hospital. In our case, each centre may be different in what they do. However, in our case, we do ask that sibling come here to the Royal Brisbane Hospital, have their medical assessment, and we can make the plans and everything through our donor coordinator for the donation process. Now, if there's a fully matched donor, sibling donor, as I said, we won't do any further searching. However, if there is a degree of match between the sibling, what we will then, or no match at all, what we'll then do is go on to an unrelated donor search with the Australian Bone Marrow Donor Registry. Now, the Australian Bone Marrow Donor Registry, a lot of people don't know exists, but it does exist, and it exists through the Red Cross. Now, they provide those donors that are on that register, they are willing to donate their stem cells for someone in the world at any time. So it's an altruistic donation process, so there is no payment for it. However, what they reap in benefits of doing that kind gesture is great as well. It is a voluntary process, so to join the register, you are volunteering to do that. Now, the Australian Bone Marrow Donor Registry does have a website. You can either type in ABMDR and it will come up, or alternatively, we'll have a link. There is the Strength to Give website as well, which is strengthtogive.org.au, and that can take you through the process of how to become a donor with the Australian Bone Marrow Donor Registry. Now, as I mentioned before, siblings, they have a blood test to check their tissue typing status, but with our volunteers on the Australian Bone Marrow Donor Registry, they now are having what we call a buccal swab, which is a swab of the inside of their cheek. So much easier process for donors who are willing, for people who are willing to become a donor. They register at Strength to Give, then a pack will be posted out to them. They can take that swab themselves. There is paperwork that they need to complete. Then you post that pack back to the Australian Bone Marrow Donor Registry, and they will confirm your registration and the fact that you will sit on the register. Now, how the process works with the unrelated donors from the Australian Bone Marrow Donor Registry is we take care of, we are an accredited centre for the Australian Bone Marrow Donor Registry for Queensland. So all Queensland donors come to us here. Once again, they have to go through a medical assessment themselves, and then the donation process is coordinated. So in both the siblings and the unrelated donors, we do like to have them close to the Royal Brisbane Hospital for their donation. They have to come here for their donation, and generally we'll get them here closer to time to go through that process. But the medical assessment needs to be done here as well, and that's usually done about 2 weeks or so before the donation. With the Australian Bone Marrow Donor Registry, as I said, they are, you will also be involved with the Red Cross because the ABMDR is run out of the Red Cross. So they would also be in touch with you as well as our donor coordinator here to organise all the logistics and everything for that donation process. But if you go to that website, you can either search for ABMDR or strengthtogive.org.au. Both of those have information around the donation process. And as I mentioned before, sometimes we have cousins or extended family members or even friends of our patients who are wanting to be tested. We don't do that here, but if they're willing to help their friend or family member plus anyone in the world, they then can join the register, and they will be found if they are a match to their loved one or someone in the world. Now, I say in the world, so the ABMDR is the Australian register. There is registers all over the world. Each country has their own register, or sometimes they have a few different registers. When our unrelated donors are donating, they are donating for Queensland people, they are donating for Australian people, and they are also donating for international. So we don't have much information around the recipient. All we are told it is all donor numbers and recipients, all anonymous process, and we just know that the country that the cells are going to, the age and the sex of the recipient. So that's all the information we have, and that's all the information that you'd be given for your donation. But the donation happens here, and then the cells are collected and travel to wherever the transplant centre is in the world. So with the siblings, as I said, we'll want to keep them here, so they will come to Brisbane, they will be assessed here and also do their donation here. And of course, usually the collection process is happening on one floor, and one floor above our patients are getting ready to receive those cells, usually on the following day. The length of time, so there's two ways that we can collect the stem cells. Predominantly, we do what we call a peripheral blood stem cell collection, and that is where the donors have 4 days of injections, and then on day 5, they are connected up to a machine called an apheresis machine, and that apheresis machine basically collects an excess of stem cells from their blood. It's all outpatient, and you can, while you're connected to the machine, you are connected for quite a few hours, but while you're connected, you are fed and watered, and you can have a support crew there with you as well through that time. Afterwards, we do recommend that you take the day off work after. Through all the injections days, people still work, we understand people have work lives, people have family lives and that, so you can work through those 4 days of injections. Day 5 being the collection day, you need to have that day off work or off family commitments, because that's a full day, and we ask that you have someone to take you home just because you can feel a bit tired and washed out. And the following day, we have you booked in for a second day collection. However, most times we don't need that second day. All of our donors do a good job of enabling us to collect all the stem cells in the first day. So the second day, we do recommend you have that off work just because you'll feel a bit tired and washed out afterwards. And then you can return to work afterwards, and we can give you, for either related donors or unrelated donors, we can give you medical certificates to help you support if you've got to be away from work on those days. Okay, so we've talked about our donors, so related and unrelated donors. So you may have a sibling donor that donates, or you may have an unrelated donor that donates. And then we've got to all bring that all back to the patient as well. So I mentioned earlier that patients may go through chemo and or radiation as what we call conditioning prior to receiving the stem cells. And then after they receive the stem cells, there is a recovery time that they will be in hospital. So with those stem cells that come from a donor, whether it be their sibling downstairs in our apheresis unit, or whether that donor is coming from overseas, the cells arrive in and are administered on what we call day 0. So that's just after all that chemo and radiation. The actual transplant or infusion of the stem cells is just like a blood transfusion. It goes over an hour, hour and a half to 2 hours, just depending on how the patient is. And oftentimes a lot of patients say it's a little bit of a non-event. They are a bit, oh, is that all that happens? So, it's a big event, but it is also not too much involved with it, which is nice. Moving on from that time, then that is the recovery time, because there will be a period where blood counts will drop and you'll have side effects of chemo and radiation. And then we need to wait for those new stem cells to repopulate your bone marrow and for your blood counts to regenerate back up. Total inpatient stay is depending on the centre, can be several weeks, and it depends on how you are feeling and how everything is going. Now, from the patient's perspective, if it's their sibling donor, you know, often the siblings still visit them and are still in close contact with them. However, if it's a case of an unrelated donor, some patients say, well, can I say thank you? What can I do? As I said before, it's all an anonymous process. So the patient will know that their donor is coming from such and such a country, and then this age and this sex. And yes, they can send just a thank you note, but it all has to be anonymous through that. But there is no obligation to do that as well at all. These donors are doing this as an altruistic venture that they're doing, which is great, and we're so very lucky to have them doing this process. The ABMDR is the Australian register, and as I said, there are several registers all over the world. How we start with the donor search is we'll look at full siblings. If there's no match at full siblings, then we'll start a search on the Australian Bone Marrow Donor Registry. Our search coordinators, they will look at all of the Australian donors on the register to see if there's any compatible matches. And if there's no matches on the Australian register, then we'll move to the international registries. It might be the US registries, German, English registries all over the world. So we will sort of look at where is the best fit in order to find the best match for the patient. If there's a case that there's no sibling full matches and there's no unrelated donor full matches, well then what we can explore is what we call a haploidentical donor, which is a 50% match. And that may be still a family member, or it may be an unrelated donor on the donor. So there is more options there that we can continue to explore. Now, the time from a patient being diagnosed to them having their transplant can be several months. However, it's really important that we start the donor search early after the patient's diagnosis because we need to, it takes a little bit of time to do all the testing. It is intricate testing, so it takes a lot of time. And also, if patients are interstate or, if siblings are interstate or overseas, well, then we need to give that time for those results to be processed in their home countries and travel, etc. So that time we need to allow, and that's why so early in the process, we will start the donor search, and then the patient continues to go through their treatment. A decision may not be definitely made that a patient is going to need a bone marrow transplant when we start this process. It's not a guaranteed you're going to have a transplant. Your doctor will continue to talk to you about through your treatment as to whether or not you are going to need a transplant. However, it's important that we start the search so we have the answer to that question. The doctor has the answer to that question when required, and that can help in their decision making for the doctor and also for yourself in what treatment path you choose. So just because you have the testing doesn't definitely confirm that the patient that you're going to need the transplant. It's allowing sort of choices and options in your treatment trajectory as you travel along. The other thing I forgot to mention too is the patient actually has tissue typing blood tests at diagnosis or early on in their diagnosis. So those blood tests are exactly the same as what the donors go through, be it a blood test or be it a swab, because that's what we're going to compare all of our results to. In the tissue typing, what we particularly look at is what we call Hla markers or antigens, which we inherit from our parents, and those little flags are what we are using to choose the best donors. So that's why we look at full siblings first, because they've come from the same parents. And if there's no match there, that's when we'll move on to looking at other donor options, which is generally the ABMDR. Now, when we're starting to plan the patient and their transplant, we time it according to their doctors are in touch with us, and we will time it to the best time based on all the treatment they've gone through and where they're at. Now, for the patients, there's a lot. Not only do we have to do assessments on the donor to make sure that they're fit and well and healthy to be the donor, we've also got to make sure that the patient is fit and well to be able to go through the transplant. So they need, before the transplant, they do what we call a workup, a medical workup, which is here at the hospital as an outpatient, and it involves several tests. That's looking at organ function and creating baseline observations for the recovery post the transplant. Now, the appointments include heart scans and breathing tests and skin checks and all sorts of chest x-ray, lots of blood tests. But also you'll sit down with your bone marrow transplant coordinator, and together they will go through the transplant process. and explain sort of day to day what's going to be happening, your recovery period, what happens when you're discharged from hospital and in the post-transplant follow-up period, when can you go home, what can you bring into hospital, all those sort of questions that you might have on your mind that they can sit down and go through with you. So it's a really good opportunity for you to write down any questions that you have in this preparing process, so that when you get to sit down, you'll be able to go through those questions and answer those for you. Now, that pre-transplant workup usually happens for us. It has to happen for our accreditation standards. It has to happen within the 30 days of day 0. So that's why it's quite close. A lot of people sometimes think, oh, can it be earlier? No, our accreditation standards are such that we have to have that within 30 days of their day 0. So it's usually sort of 2 weeks or so, 2-3 weeks before you start your chemo and radiation. And at that education time too, we'll give you day by day what's going to happen, including start dates, where you've got to be, all those sorts of things. Always good for a family member or a friend to be with you. As always, 2 pairs of ears is always more helpful, so that you can have any questions and they can be listening to things that maybe you tuned out or didn't hear on those times.